We like to educate everyone and let them know that for every dollar we spend in family planning, we actually save the community $7 in unintended pregnancy costs, as well as long-term social services costs. The majority of our funding actually comes in the form of reimbursements through Medicaid, so we don't actually get like a line of credit or a lump sum from the government. A lot of the time our funding is reimbursed after the fact. We have seen our patients, and then we get whatever the state decides is a fair reimbursement for those services. Next slide, please. So what is happening with abortion currently across the country? As many of you know, Roe was overturned. One second. On June 24th of this year, which means that the decision to allow for abortion was bounced back to every individual state. So because in 1970, Washington State passed that referendum to make sure that abortion is legal in the first trimester, we still have the right to abortion services in Washington State. But because it is not actually included in our state constitution, if Roe v. Wade was overturned on a federal level, we would be in the same situation as other states. So currently, after Roe v. Wade was overturned and sent back to each individual state, 44 states enacted restrictions in one way or another on abortion services. 12 states enacted an all-over abortion ban. And of those 12 states, one state imposed restrictions at 6 weeks. 2 states have imposed restrictions at 15 weeks, and 1 state at 20 weeks. 9 other states imposed an abortion restriction at 22 weeks, and 4 states have imposed restrictions at 24 weeks. The most dangerous restrictions are, of course, the ones that happen at the 6 and 15-week mark, because our community does not have access to medical care a lot of the time. A lot of our patients don't even know they're pregnant until the 2nd or 3rd missed period. So those restrictions are very severe, although they might not sound severe for low-income patients, because they kick in whether you have insurance or not. So it just makes it so much harder for our patients to get the care that they need. In addition to abortion restrictions, many states will be pushing to impose other restrictions, such as parental notification bills, as well as partnership. I don't even know how to explain it, where your partner has to sign to give you permission to be able to receive your medical care, which we know for our patients who are not in safe relationships, that's not possible. So we don't want extra restrictions on that. Next slide, please. So we are doing the most that we can to reach all our patients. From our existing inpatient appointments that we provided in person, we have been very busy collecting funding and making sure that we can get emergency contraception vending machines installed outside of all of our health centers. Currently, I believe we have 6, which are in Yakima, Kennewick, Spokane Valley, Walla Walla, and Moses Lake. So we are working to make sure that we have a vending machine outside of all 11 of our health centers to make sure that our patients have access to that emergency contraceptives when we are not open, because as we've seen, if you go to a convenience store or pharmacy, emergency contraception is sometimes sold for up to $75, which is a huge burden to our patients. And at our machines, we can sell it 24/7 for $25. Again, when we are not open. We have expanded on our telehealth appointments and are working to make sure that those telehealth appointments can be later implemented for our abortion care services as well. We also have implemented birth control by mail and STI testing by mail. The pandemic hasn't been all bad. It's also pushed a lot of our health organizations to seek better ways to help our patients, and luckily that has helped a lot of our rural patients the most. We also count with curbside pickup and drop-off of prescription services. Besides these services, I know I previously mentioned mobile clinics. We started rolling out our mobile clinic services during the pandemic in the year 2020. Our pandemic services helped us provide vaccinations, both COVID vaccinations as well as flu vaccinations to over 25, this year alone, we were able to host 25 clinics and help over 1,300 patients. At these mobile clinics, depending on the site we were hosting these events, some of them provided bathrooms, some of them did not. So depending on those sites, we were able to provide STI testing and treatment on site as well, and physical exams for our patients who may not be able to see us. We also try to, we realized that our hours of operation may not encompass 100% of our community, whether it's college students who work during the day and can't come, take time off to see us, or a lot of these mobile clinic sites that don't even have a clinic on site. Again, this year online, we were able to host over 25 clinics. We've been able to host over 50 clinics since we started 2 years ago. And we were able to visit towns like Mapton, Wapato, and Quincy. When we were in Quincy, a few people told us that they had to drive 40 minutes to get to a community health center that they could afford and had availability to see them. So we actually visited Quincy a few times, and we were very proud to provide these services. Although our mobile clinics were a program implemented through COVID, we have realized that they've really helped us reach our rural community, mostly our Latino and farm workers communities. And we are working to maybe get some funding to move up to a mobile trailer so that we can make sure that we have those testing facilities. Those mobile trainings include restrooms as well and a lab on site. So that way we can actually help. And also all of these clinics are held on weekends so that we can help everybody who may not be able to take time off during the week to see us. Next slide, please. So we've talked a little bit about our direct services, and now I want to talk about our actual direct advocacy work. We have worked tirelessly throughout the years to help bring protections to our state to make sure that nothing happens, not only to our services, not just abortion, but birth control as well, and to make sure that they are funded and available for everyone. I started working for Planned Parenthood in 2013 as a community organizer, and way back then we were already working on the Reproductive Parity Act. This bill required all state regulated public insurance companies to cover all pregnancy care equally, including abortion care, which was not. Previous to this bill, most abortion companies could opt out of covering abortion services, so a lot of our community members couldn't access abortion care even if they had private insurance. So we worked really hard to get this bill passed in 2018, and now everyone in Washington State who has private insurance has access to abortion care. In 2019, we passed the Reproductive Health Access for All Act, which further expands on the Reproductive Parity Act. This act made sure that Medicaid also covered abortion services. So anyone who qualifies for Medicaid can now receive abortion services as well as complementary birth control and emergency contraceptive, thanks to the Reproductive Health Access for All Act. And although we were able to pass that great legislation, we kept pushing, and this year in February, we were able to pass the Protecting Providers' Right to Provide Abortion Care Act, also known as House Bill 1851. And this bill expands even further on the Reproductive Parity Act by making sure that we removed all gendered language to make sure that our trans patients didn't encounter any barriers when it came to their receiving of hormones, birth control, and abortion care as well. We added protections against prosecution for any medical staff providing abortion care services. We are now, this year, we're going to work on a bill to help make sure that no traveling health providers get prosecuted in Washington State. It is really unfortunate that we have to deal with these types of things, but this bill makes sure that no one in Washington State can be prosecuted for either providing an abortion or miscarriage management or seeking an abortion as well, which across the country is a big topic of conversation now because, again, it is based on each individual state to set their restrictions. And one of the most important portions of this law that is going to help us really help our rural patients is that this bill allows for physician assistants and advanced practice registered nurses to provide abortion care as well. Now this has already been implemented in states like Hawaii, and a lot of, in most states, these advanced practice nurses and physician assistants already get the practice and the training that they need to provide abortion care. They are just as well-versed in this care as a regular physician. And so we don't want their training to go to waste, and doing this will allow a lot of our rural physicians to be able to provide abortion care where they may not have been able to have a physician visit. Currently, because of abortion laws and the dangers to our providers, many clinics opt to have visiting providers, so the provider never really lives in the community that they serve. Like our specific provider comes over from Seattle once a week for their safety as well. Because of this, we are only able to provide abortion care when our provider is in our facility, and that's about once a week, if that. But this is going to open up for all of our physicians to provide that care without the need for a physician to be in the clinic providing that care themselves, which also reduces the cost for a lot of our community health centers. Next slide, please. And so that just leads us to how you can all get involved. We have so many volunteer opportunities, whether it's tabling out in our community. Our electoral season just finished up, but we were busy canvassing and phone and text banking in all of our communities to make sure that we can help support representatives that are best going to support our patients. You can share your story. Even being an active, open supporter of Planned Parenthood helps, because that helps us reduce the stigma that comes along with our services. Of course, we are always accepting donations. Again, any of the services listed on that slide, if you have private insurance, you can come see us for those, and that will help supplement our uninsured patients. And we have also plenty of job opportunities, so if you're ever looking for a job, come work with us. And that is another way that you can all help us.